Ironic that in a field pioneered by so many Jewish thinkers, we find ourselves having to confront anti-Semitism within our own professional circles. The events of October 7th have unleashed a storm of biased statements from mental health organizations and their affiliates focused solely on Israel, ignoring tragedies around the globe. Psychologists in official listservs, publications, and conferences refer to Israel and Zionists with modern-day blood libels as an occupier, apartheid regime, and of committing genocide. They promote BDS and stress the importance of so-called context when it comes to the October 7th massacre. It is crucial to highlight that none of the leading psychological organizations which claim a commitment to addressing trauma and fostering healing have spoken out about the horrific acts of sexual violence perpetrated by Hamas on October 7th. Anti-Semites have been invited to keynote and address mental health conferences, leading to intimidation among Jewish attendees. Blacklists of therapists with so-called Zionist affiliations have been created online. Therapists who are Jewish and suspected of being Zionists have been kicked out of therapy discussion groups. Psychology students have been told by their professors that their Jewish identity does not count as an identity worth studying since it is not marginalized. Jewish students report being subject to anti-Zionist and anti-Jewish training in their graduate programs. They report being excluded from spaces for individuals of Middle Eastern backgrounds due to the false claim that Israeli heritage does not constitute a Middle Eastern identity. They face questioning about the legitimacy of their experiences of anti-Semitism and confronted with age-old harmful stereotypes. This is not just exclusion, it's erasing their identity, their lived experiences, and their struggles. Jewish mental health professionals feel a profound sense of betrayal, marginalization, and silencing by the very organizations that serve as our professional homes, institutions to which we have contributed significantly, often leading efforts in social justice initiatives. Jewish psychologists and their allies have called for acknowledgement of anti-Semitism, education about Jewish people, and accountability, yet our calls are ignored. Moreover, our lived experiences with anti-Semitism are continually denied. We've raised our voices about anti-Semitism, but we've been silenced or told we're privileged and have no right to complain. Jewish colleagues are being bullied for their views or for merely standing up against misinformation campaigns, counseled for so-called Zionist affiliations, and subject to litmus tests requiring us to deny our identities in order to prove our loyalty to social justice causes. The surge in anti-Semitism has triggered mental health issues, and Jewish patients need culturally affirming and responsive care. Yet Jewish clients are being gaslit about their anxieties and fears about anti-Semitism. Enough is enough. We demand accountability. Mental health organizations that receive federal funding, such as the American Psychological Association, must follow their own ethical guidelines, hold those within the organization accountable for ethical violations, and address the deep-seated anti-Semitism that has always been present but was unleashed after October 7th. It's time to confront this hate for the sake of the profession and for the sake of those it is intended to serve. Thank you.